How to manage challenges, stroke problems during first-time pregnancy. Bleeding in the gums. When you are pregnant, you may experience some swelling and pain in your gums, especially when you brush. You may notice blood from your gums while you brush, which often happens when there are hormonal changes as a result of being pregnant. The condition is commonly known as pregnancy gingivitis and can also sometimes be an indication of gum disease. And make sure you speak to your doctor and dentist about it. Painful urination. A urinary tract infection is a burn in every woman's life. During pregnancy, a woman becomes highly susceptible to urinary tract infection. The changes that pregnancy causes to the urinary tract makes it very easy for a pregnant woman to contract a UTI. Additionally, the pressure from the uterus prevents the bladder from completely draining, and this causes infection. If you leave a UTI untreated, it can lead to kidney infection. Feeling very hot. It is quite normal to feel hot at all times, even when the weather may not be that hot. You may feel that you are always sweating or feel too flushed and uncomfortable, as if you are having a heart stroke. The change in your hormone levels, along with the increase in the supply of blood to your skin, is responsible for this increase in your body heat during pregnancy. Urinary incontinence. Urinary incontinence is a condition in which you may unwillingly end up leaking a little urine while you cough, sneeze, or sometimes even laugh out loud. Though it can be extremely embarrassing, it is one of the very common problems during pregnancy and for some time after your pregnancy. Continuation. When you are pregnant, your pelvic muscles begin to relax and prepare for the impending birth. It means that you have less control over your pelvic muscles. You can ask your doctor to recommend you some pelvic floor exercises and also let you know which ones are safe for you to try. Strange and unexplainable dreams. It may often be scary, but it is extremely normal to have vivid dreams when you are pregnant. In most cases, the dreams will be extremely strange, and you will find it hard to explain why you had such a dream in the first place. Continuation. Having such dreams is extremely common. When you are pregnant, especially if you are pregnant for the first time, it can give rise to a lot of anxiety and confusion. You may constantly be worrying about how you will cope up as a mother, how you can ensure that both you and your baby are safe, and many more such things. The uncertainty, the anxiety, and all the hormonal and other changes happening inside you are what can lead to the unexplainable and vivid dreams. Constipation. The many hormonal changes in your body can often leave you feel constipated or make it very uncomfortable for you to pass stool. To avoid constipation, make sure you drink at least 8 to 10 glasses of water each day. Consider including more liquids to your diet, such as fresh juices, milkshakes, tender coconut water, and such. If your doctor has started you on iron supplements, ask if you can change the brand or put it on hold for some time. This is one of the sin problems of pregnancy. Feeling excessively tired. The many hormonal changes that you experience will make you feel tired at all times, even if you have rested well. Listen to your body and get rest wherever you feel tired. Avoid walking too much or doing things that can tire you. Sometimes you may start feeling tired only around the 3rd trimester. But in many cases, you can also feel very tired during your first 12 weeks. Itching. When you are pregnant, your body will pump a high amount of blood to your skin. As a result, you feel the skin starts itching. Once you reach towards your 3rd trimester, or your bump starts to grow considerably, it will stretch the skin around your abdomen and lead to more itching. Continuation. Mild itching is common and natural, but make sure that you do not suffer from severe itching. If you do, it could be a sign of a health condition known as obstetric cholestasis or intrahepatic cholestasis of pregnancy. Headache. You may experience mild headache in the first few weeks of pregnancy, while in some cases it could also be quite severe. Even though they are a normal occurrence, headaches can be very uncomfortable. The main reason you experience headaches when you are pregnant is the change in your hormone levels. Continuation. Try yoga or relaxation techniques. Make sure you get enough sleep and are well rested, and drink at least 8 to 10 glasses of water to minimize the discomfort, heartburn, and indigestion. The hormonal changes you go through will lead to indigestion, sometimes as early as the start of your 2nd trimester. Also, as your unborn baby grows bigger and your womb expands, it will put a considerable amount of pressure on your stomach. As a result, you can experience a lot of indigestion and heartburn. Bleeding through the nose. While it can definitely make you panic, a little nosebleed when you are pregnant is actually very common and nothing to worry about. The main reason is the change in your levels of hormones. Also, when you are pregnant, your skin tends to get drier than usual. The same applies to the skin inside your nose, which can often feel chafed and bleed a little. Continuation. Eat light meals and break them up into 6 small meals through the day instead of 3 big ones. Avoid eating fried or oily food and opt for lighter meals. Do not stay hungry as it can trigger heartburn. Leakage from the nipples. You probably thought that you will start producing milk once your baby arrives. In fact, your body will start preparing milk as soon as you're pregnant. It is absolutely normal for your breasts to start leaking a little milk when you are pregnant. The fluid that you will see now will be colostrum, the first milk that your body produces. Increase in vaginal discharge. During pregnancy, you may notice an increase in the amount of discharge from your vagina. Not only will the amount change, but you will also notice a difference in the texture and the smell of the discharge. Do not worry, as it is extremely normal. When you are pregnant, the walls of the vagina will turn softer. The increase in the vaginal discharge will help to ward off any infection that can otherwise move from the vagina to the womb. Bleeding from the vagina. While bleeding from your vagina while you are pregnant is a common and normal occurrence, you need to tell the doctor about it the moment you spot it. The little blood you notice during your early pregnancy is known as spotting. It happens when the embryo gets implanted in the walls of the womb. Continuation. If you notice the bleeding in the first 12 weeks of your pregnancy, it could also be a sign of miscarriage or an ectopic pregnancy. Do not panic yet, as many women who do experience vaginal bleeding during this time also go on to have health pregnancies and births. Make sure you do inform your doctor immediately about it. Unable to sleep or insomnia. As tired as exhausted as you may feel when you are pregnant, it is also possible that you will find it difficult to sleep. The many changes in your body and the hormonal imbalance that you are going through at this time will also make it difficult for you to get proper sleep. Once your abdomen grows considerably, you may also feel a considerable amount of pressure when you lie down. Continuation. Don't think about it too much, as it will make you worry more and further erode sleep. Try and find a position that you feel is most comfortable for you. If you feel you can't sleep for too long at a stretch, nap during day and wherever you can. You can also try and sit in a comfortable chair and get some sleep. Pain in the pelvic region. While it is not extremely common, many women do experience a lot of pain and discomfort in their pelvic region while they are pregnant. The pelvic pain during pregnancy is known as pregnancy-related pelvic girdle pain, in brackets PPGP, or syphilis pubis dysfunction, in brackets SPD. Some common symptoms of are pain on both sides of your lower back, pain in the area between your vagina and the anus, and pain over and near the pubic bone. Continuation. You can feel pain most when you are walking, turning in bed, climbing stairs or standing on one leg. Speak to your doctor immediately as soon as you notice the pain problem during pregnancy. Swelling. After 20 weeks of pregnancy, swelling is considered to be normal in most women. This is caused by a change in blood volume and blood flow, allowing fluids to be trapped in the tissue around the extremities. But swelling in the first trimester, especially in the face and hands, could be an indicator of pre-eclampsia. Always consult your doctor if in doubt about such things. Nausea and vomiting. Morning sickness is the most common affliction that affects a pregnant woman during her first trimester. It affects different women differently. For some people, it could be extreme and it increases the risk of dehydration. Some women cannot hold down anything that they eat. It may lead to reduced nutrition for the mother and fetus. Doctors may recommend some medication to regulate nausea and prevent dehydration in extreme cases. Difficulty in breathing. Increased level of progesterone during the first trimester contributes to the shortness of breath. Walking slowly, sitting up straight, and sleeping on propped up pillows might help with easing breathing problems during the first trimester of continuation. Once you are past the first trimester, the shortness of breath usually occurs around the third trimester, when your uterus pushes up against the diaphragm and the lungs, making it difficult to take a deep breath. If wheezing, palpitations, or coughing pregnancy accompany shortness of breath, then you should let your doctor know immediately. They may be able to tell the difference between plain shortness of breath and other complications. Thank you for watching the video. Please like, comment, and share. If you would like to hear about more health and beauty tips, kindly subscribe to the channel. Have a great day and a healthy day. Thank you.